What I'm about to share with you today may be the most important medical information you hear this entire year. Because there is an organ sitting silently inside your body right now, an organ you almost never think about, that may be sending you urgent distress signals that you have been dismissing or misattributing to something else entirely for months or even years. And by the time most people discover their pancreas is in serious trouble, the damage is already severe, and the window for full recovery has often already closed. Now take a look at this. The pancreas sits tucked away behind your stomach, nestled near other critical organs. It is a detailed anatomical view of this hidden but critical organ that plays a dual role in your health. I'm Dr. Marty Makary. Today, we are talking about the pancreas, one of the most underappreciated, most misunderstood, and most critically important organs in the entire human body. When it begins to fail, it produces a cascade of symptoms. Symptoms that affect virtually every system in your body: your digestion, your blood sugar, your weight, your skin, your back, and your brain. Symptoms that most people, and even some doctors, attribute to aging, stress, or other conditions entirely, while the real source quietly worsens. Imagine a patient describing vague symptoms like fatigue, back pain, or digestive discomfort to their doctor. Both are completely unaware that the pancreas is the real source of the trouble, which is why it so often goes undetected. The pancreas performs two completely distinct and equally critical jobs. First, it produces powerful digestive enzymes: lipase to break down fats, amylase for carbohydrates, protease for proteins, that flow into your small intestine. This extraordinary process happens inside your body every day, ensuring your digestion and energy levels are maintained. These are absolutely essential for absorbing virtually every nutrient you consume. Without them, your body cannot nourish itself. Second, its beta cells produce insulin that allows glucose to enter your cells for energy, while its alpha cells produce glucagon to raise blood sugar when it drops too low. This balance is vital. When either of these functions fails, the consequences ripple through your entire body in ways that are profound, progressive, and permanent. Warning sign number 1. Upper abdominal pain that radiates to the back. This is the most classic warning sign. It is also the most consistently misdiagnosed warning sign of pancreatic disease in America today. We must change that. Because upper abdominal pain radiating to the back is common, and it almost always gets attributed to muscle strain. It might be blamed on kidney issues or gastric reflux. The pancreas is almost never considered first in these cases. But pancreatic pain has specific characteristics that distinguish it from everything else. It begins in the upper middle or upper left abdomen. It radiates to the mid-back or left flank with a deep drilling boring quality. It is notably worse after eating. This referred pain pattern is what distinguishes pancreatic issues from musculoskeletal causes. Recognizing it can save your life, especially fatty meals that force the pancreas to produce large enzyme volumes. This is a very important clue. And critically, it is better when leaning forward and worse when lying flat. That positional characteristic is a clinical hallmark. If you have upper abdominal pain radiating to the back that improves when you lean forward, this demands investigation this week. Not next month, this week. Do not wait for it to get worse or assume it will just go away on its own. Warning sign number 2, unexplained and unintentional weight loss. This is a major medical red flag. When an older adult loses weight without trying, without changing diet or exercise, that demands urgent medical investigation. Pancreatic dysfunction causes weight loss through 2 insidious mechanisms. First, when the pancreas stops producing adequate enzymes, food passes through incompletely digested and nutrients are not absorbed. Your body absorbs only a fraction of what you eat. Muscle breaks down, fat stores deplete, weight drops despite adequate caloric intake. You are starving even as you eat. Second, when pancreatic cancer is present, the tumor causes profound cancer cachexia, a devastating wasting syndrome. This wasting syndrome does not respond to increased eating. It is a metabolic shift caused by the disease itself. Imagine noticing you have lost weight without trying. You haven't changed your lifestyle, but the numbers keep dropping. The number to know: unintentional weight loss of more than 5% of body weight over 6 to 12 months. For a 160-pound person, that is just 8 pounds. It might not seem like much, but it is a critical signal. If this describes you or someone you love, see a doctor immediately and specifically request pancreatic evaluation with imaging. This invisible malnutrition is a direct result of pancreatic exocrine insufficiency. It must be addressed urgently. Warning sign number 3, changes in stool that most people are too embarrassed to mention. Let's talk about it openly. When the pancreas fails to produce adequate lipase, the fat-digesting enzyme, undigested fat is excreted in the stool. The result is steatorrhea, pale, greasy, foul-smelling floating stools that are difficult to flush. The result is steatorrhea, pale, greasy, foul-smelling floating stools that are difficult to flush. They may leave an oily film in the toilet water. This is one of the most specific indicators of pancreatic failure. It is almost never reported because patients are embarrassed, and almost never asked about because doctors forget to inquire. If your stools have become pale, greasy, and floating, tell your doctor using those exact words. Don't hold back. Those 8 words, "My stools are pale, greasy, and floating," can lead directly to a diagnosis that changes everything. Additionally, pale, clay-colored stools combined with dark urine and yellowing of the skin or eyes indicates bile duct obstruction. This indicates a possible pancreatic mass. This classic triad is a medical emergency requiring same-day evaluation. Imagine noticing your eyes have turned yellow. Do not wait to see if it resolves on its own. Call your doctor immediately. Warning sign number 4, new onset diabetes or sudden worsening of previously stable diabetes. This is a vital clue. Researchers have identified type 3C diabetes, pancreatogenic diabetes, which develops as a consequence of pancreatic disease. When a growing pancreatic tumor disrupts pancreatic architecture and destroys beta cells, insulin production fails and blood sugar rises. This produces diabetes that looks identical to conventional type 2 on routine testing. That is why it is consistently missed. Imagine seeing suddenly elevated and uncontrolled blood sugar numbers despite no changes in your diet or lifestyle. The specific pattern, new onset diabetes in a person over 50 who is not significantly overweight and has no family history. Or sudden loss of blood sugar control in someone who had well-managed stable diabetes for years without any explanation. A landmark study published in JAMA found that among patients diagnosed with pancreatic cancer, many had developed diabetes earlier. They developed new-onset diabetes 1 to 3 years before the tumor was found. The diabetes was the early warning sign. Recognize this pattern. Act on it immediately. It could be the key to catching pancreatic disease in its earliest stages. This critical early detection window is what recognizing this pattern can open. Do not ignore sudden blood sugar changes. Warning sign number 5, persistent nausea, appetite loss, and early satiety. This means feeling full very quickly. Persistent nausea without an obvious cause, a deep, generalized loss of interest in food that goes beyond ordinary fluctuations. Imagine sitting down to a meal and feeling uncomfortably full after just a few bites. This early satiety is a serious warning. An inflamed or enlarged pancreas can press directly on the stomach, physically reducing its functional capacity. A pancreatic tumor can compress the duodenum, causing gastric outlet obstruction and severe early satiety. Eating becomes associated with pain and bloating. Your brain learns over time to suppress appetite as a protective response. Warning sign number 6, upper back pain without injury. This is so common that it is often reflexively dismissed. The pancreas sits directly in front of the spine. When inflamed, it sends signals through the celiac nerve plexus. The pancreas sits directly in front of the spine. When inflamed, it sends pain through the celiac nerve plexus. These signals are perceived in the mid-back and left flank. This referred pain can be the primary or only early symptom. The distinguishing features: the pain is in the upper or mid-back, not the lower back. It doesn't change with movement. It does not respond to positional changes like standard back pain does. It may also worsen specifically after you eat. If you have been treated for back pain that has not responded to physical therapy or anti-inflammatories, request imaging. Request abdominal imaging to specifically evaluate the pancreas before assuming your back is the primary source. Imaging answers definitively whether back pain is pancreatic in origin. It is a vital step in your diagnostic journey. Warning sign number 7, yellowing of skin and eyes, known as jaundice. This is one of the most serious presentations. When a tumor in the head of the pancreas compresses the common bile duct, bile cannot flow normally. It backs up. Bilirubin deposits in the skin and the whites of the eyes, producing that characteristic yellow discoloration. Stools turn pale because they lack bile pigments. Urine turns dark because bile is excreted through the kidneys instead. This unmistakable yellowing, scleral icterus, is often the earliest visible sign of jaundice. Take it very seriously. Painless jaundice in an older adult is a medical emergency. Pancreatic cancer classically presents this way first. If you notice this yellowing, go to an emergency room the same day. Not urgent care next week, the emergency room today. This symptom demands imaging within 24 to 48 hours. Decisive action is the only appropriate response here. Warning sign number 8, generalized itching without a rash. This is often maddening and consistently misdiagnosed. When bile cannot flow normally, bile salts accumulate in the bloodstream and deposit in your skin. This causes intense itching, particularly on the palms and soles, and it is usually much worse at night. Antihistamines provide almost no relief because this itch is not histamine-mediated. It is driven by bile salts. It's often misdiagnosed as an allergy or dry skin and treated with creams that do nothing for the underlying cause. Imagine the frustration of intense itching with no visible explanation. This could be a direct sign of pancreatic obstruction. If you have persistent itching without a rash, ask your doctor specifically about cholestatic pruritus and biliary imaging. This biochemical mechanism is what makes this symptom such a distinctive and diagnostically important signal. Warning sign number 9, sudden blood sugar crisis in someone who has never had diabetes. This is a terrifying event. When acute pancreatitis is severe, a large portion of your beta cell mass can be rapidly destroyed. Blood sugar spikes. This acute hyperglycemia, combined with severe abdominal pain and vomiting, is a clear medical emergency. The most common causes are gallstones lodging in the bile duct and alcohol, even at levels people consider moderate. But certain medications and severely elevated triglycerides can also trigger acute pancreatitis through toxic fatty acid release. This blockage triggers an explosive inflammatory cascade. It is a biological fire that must be put out immediately. Warning sign number 10, unexplained profound fatigue, depression, and cognitive changes. This is deeply impactful. Pancreatic disease produces systemic inflammation that directly impairs brain function. It disrupts your very chemistry. Inflammatory cytokines disrupt serotonin and dopamine signaling, producing profound emotional flatness and social withdrawal. Malnutrition from enzyme insufficiency and blood sugar variability further impair your cognitive performance every day. Research has found that these cognitive changes frequently precede the formal diagnosis of pancreatic cancer by months. When fatigue, depression, and cognitive changes occur together with any of the other signs, this constellation demands evaluation. Profound, unrelenting fatigue is not just a part of aging, it is often your body's way of signaling serious internal stress. Now let me tell you exactly what to ask for if you are concerned. Describe your symptoms with precise, specific language. pale, greasy, floating stools. Upper abdominal pain radiating to the back. Unexplained weight loss over specific months. Specificity drives appropriate diagnostic response. It helps your doctor understand the true nature of your distress. Holding a written list ensures you don't forget anything. Present your symptoms methodically and clearly. The blood tests that matter: serum lipase and amylase, CA19-9 tumor marker, and fasting glucose levels. Include liver function tests and bilirubin to check for bile duct obstruction. These provide vital clues for your doctor. The imaging that matters most: abdominal ultrasound and a CT scan of the abdomen with IV contrast. MRI with MRCP and endoscopic ultrasound, the most sensitive tool available for detecting small pancreatic lesions. Comprehensive imaging evaluation gives doctors their clearest picture of what is happening inside your body. What you can do today: alcohol is the single most modifiable risk factor. It is directly toxic to pancreatic tissue. If you have symptoms or known risk factors, alcohol must be eliminated completely, not reduced, completely eliminated. Smoking doubles to triples your risk of pancreatic cancer. Carcinogens reach the pancreas through your bloodstream. Stopping smoking is the single most impactful action you can take today for pancreatic cancer risk reduction. Manage your triglyceride levels. Severely elevated levels can directly trigger acute pancreatitis. This is vital. Reduce refined carbohydrates and sugar. Maintain a healthy, stable weight to reduce gallstone formation. Engage in regular, moderate physical activity. This reduces cancer risk and improves your overall metabolic health. This healthy dietary pattern protects both your pancreatic and overall metabolic health simultaneously. Start today. Here is your complete summary. The 10 critical warning signs: upper abdominal pain radiating to the back, unexplained weight loss, pale, greasy, floating stools, new onset diabetes or sudden worsening of previously stable diabetes, persistent nausea, upper back pain without injury, yellowing of the skin or eyes, acute blood sugar crisis in non-diabetics, intense itching. And finally, profound unexplained fatigue, depression, and cognitive changes occurring alongside these other symptoms. Any one of these symptoms persisting deserves evaluation. Any two or more occurring together demands urgent evaluation this week. Any combination that includes jaundice, sugar crisis, or severe pain requires emergency evaluation today. Same day, same hour. Act decisively on the warning signs your body has been sending. Do not hesitate or rationalize the symptoms away. Your pancreas has been working silently and faithfully every moment of your life. It deserves your attention now. You now have the knowledge to give it that attention. You know the warning signs and the right questions to ask. Early recognition, acting on these signals before they progress, is what determines whether intervention is truly effective. Catching pancreatic disease at a stage where recovery is genuinely possible is our ultimate goal here today. Share this video with everyone over 50 in your life, with your parents, your spouse, your siblings, and your friends. Be the person who helps the people you love hear the whisper before it becomes a shout. It truly saves lives. I'm Dr. Marty Makary. Listen to your body and advocate for yourself. I will see you in the next one. Thank you. One final bonus tip: stay hydrated. Water is essential for the production of those vital digestive enzymes. When you are dehydrated, your pancreas has to work harder to do its job. Make it easy for your body to stay healthy. A simple glass of water is a small but powerful way to support this incredible organ every single day. Drink up. Join a community, share what you've learned, and let's build a future where pancreatic disease is caught early every time. Your health is your greatest wealth. Protect it, cherish it, and help others do the same. We are all in this together. Take care of yourself, and I'll see you very soon in our next health update. Stay well, and keep listening to your body. Remember, knowledge is power, but action is what saves lives. Be the advocate your body deserves today.